Hi everyone, Dr. Remy from Pain-Free Infant and Posture Size. Today we've got a great lesson in going over the angle of your seat while you're sitting in either your chair or your car to decrease lower back pain. There's a differentiation between disc problems, spinal stenosis, spondylolisthesis, Facet syndrome, and we're going to be going over these today so you can set your chair angle and tilt up in the proper way to avoid aggravating your lower back. So a lot of you out there with chronic lower back pain have a problem with sitting, and determining which angle your seat is in is going to make a big difference in terms of the mechanical stresses that go across your back. Most of us, when we sit, should sit with our body weight over the ischial tuberosity, which is at the base of the buttock where the leg meets the butt, that crease. That's where my body weight should be centered on, and I should be sitting tall from there. Problems arise, especially for those people with disc problems, when we have a tendency to slump and allow more of our upper body weight to go backwards towards our tailbone. People with extension types of disorders, such as Facet syndrome, Spondylolisthesis, Stenosis, they have a problem when there's too much arch in the lower back, when they're sitting forward from that line between the buttock and the leg. The angle of your seat has a big role in providing mechanical stresses that produce either of these two problems. If your seat tilts down, that has a tendency to naturally roll your pelvis forward and induce more of an arch in your lower back. This is beneficial for most people with disc problems because it takes the vertical pressure on the disc and changes it so that more of the upper body weight is centered on the facet joints in the back of the spine and less on the front of the disc. Conversely, if you have an extension problem like spinal stenosis in the lower back, spondylolisthesis, or Facet syndrome, this lower seat angle where the front of the seat is lower than the back of the seat is going to increase the arch in the back and most likely aggravate your condition. If we take the opposite and make our seat higher in the front and lower in the back, which you can do in your car, this angle is a bit much, but a slight angle, you can move between slight and neutral. This angle has a tendency to drop the tailbone under and decrease the arch in the back. This is a supportive angle while driving if you have a extension problem like Facet syndrome, spondylolisthesis, or stenosis, because as the tailbone naturally tucks under with the front of the seat higher than the back of the seat, it allows that curve in the lower back to decrease, and it opens the back of the spine, taking pressure off the facet joints, the back of the disc, and the nerves that become compressed in the back of the spine. If I had a disc disorder, though, having the front of the seat upwards and the back of the seat down and causing a decreased arch in my lower back is going to put more pressure on the front of my spine, compressing my discs and most likely aggravating my condition. If you like this video on seat position and posture, feel free to subscribe to our channel. We got a lot of great videos out there that talk about exercises and posture having to do with lower back pain. If you'd like to help me share this valuable information with others, give me a thumbs up below. Let's help other people out there that are suffering. Looking for a customized healing exercise program for your lower back pain? Go to our painfreeandfit.com website. We've got a number of great programs out there that'll help you customize exercises to help support postural changes so you can sit, stand, move, and get into your physical activities with a lot less pain.